Now please welcome back Bob Cusack, joined by our panel of experts, Sue Peschin, President and CEO of Alliance for Aging Research, Rebecca Wingate, Vice President of Clinical Operations at PharMerica, and Jodi Eyigor, Director of Nursing Home Quality and Policy at LeadingAge.
Well, thanks, and thanks for coming and being part of this panel. Why don't we just start off, I'm going to combine two questions, kind of explain your job in a few minutes, your passion for this issue, and what's the one thing you want people to take away from today? Sue, we'll start with you.
I love it.
Yeah.
Thank you. Hi, everybody. I'm Sue Peschin. I serve as President and CEO of the Alliance for Aging Research. And our mission is to change the narrative in aging for equitable access and improved healthy aging for all. And around vaccines, we want to make sure this fall everybody should get their updated flu and COVID-19 vaccines. Nobody's exempt. Go get them. And they're available, so please get them. We've been involved in issues around older adults and vaccines for a number of years, and really just want to try to raise the bar in getting to better rates of uptake.
Hi, Rebecca Wingate. In my role at PharMerica, we serve 400,000 residents and clients a day in 50 states. So we have a pretty big reach for vaccines with our 300 consultant pharmacists and 100 nurse consultants. And I'm very fortunate to be able to drive the vaccine initiative with remote and on-site clinics in these care settings. And really the message is what Sue just said, the access and the uptake. We've really seen a lot of misinformation out there, especially with social media, TikTok, Instagram. You know, once something goes viral, it just really takes off and gives, you know, just a bad taste in folks' mouth, especially when the news puts a headline out. I think the congressman said it the best. Once it gets out there, it's really hard the next day to take it back. So, thank you.
And I'm Jodi Eyigor. I work for LeadingAge. We are a not-for-profit association serving individuals, members across the aging services continuum. So we have members in the nursing home space where I work. We also serve home health, hospice, all the way down to affordable senior housing. We have PACE, adult day, life plan communities. We really span the whole gamut of aging services. And we're really, really dedicated, and our members are dedicated to ensuring that the older adults they serve and the staff working in their communities to serve these older adults are afforded the safest and highest quality environments to live and work.
Jodi, just following up on that, COVID was a very intense time, especially for nursing homes, not only for residents, but also, as you mentioned, the workforce. Can you kind of say where the state of the industry is now as things have somewhat calmed down?
Exhausted.
There you go.
It was an incredibly difficult time for everyone, right? It was an incredibly difficult time for the entire world, but especially for our healthcare workers. And it was pretty heartbreaking to hear what our nursing homes were going through, because here we had our dedicated healthcare workers who were going in every day, who sometimes weren't leaving, right? They were sleeping on the floors of their offices. They were staying in hotel rooms because they didn't want to go home and put their families at risk. Every day they were putting their lives on the line, day in and day out for years. And they were unfortunately kind of slammed in the media, regardless of all of the hard work and regardless of what they were doing. You know, they're going out there every single day, putting their lives on the line, and they're calling me up and they're saying, oh my gosh, we have another outbreak, and they're devastated to be losing the people that they have worked with and cared for years. And then they receive a box of supplies from the government, and it's cloth masks, when what we really needed was N95s. Or it's a box of 20 latex gloves, and they're all a size small. And who's going to be able to wear those? And so it was just a really, really difficult time, and yet they've continued to work and continued to work through that. And here we are, you know, 4 years later, and they're still showing up for work every day and still trying every day to put their best foot forward to make it a great place to live and work.
A quick follow-up on that, though. What were the lessons learned? Obviously, there were mistakes. It was something that hadn't come across in 100 years, but going forward? Because who knows what's in the future?
Surely, yeah. So infection control, of course. We knew it before the pandemic that we really needed to focus on infection control. We needed to improve even the basics like hand hygiene, right? That's always one of the #1 tags for a nursing home is infection control, and hand hygiene is a major part of that. But we also learned things more systemically, like how our entire country needs to be better prepared for a pandemic and how our systems need to work together. So it's not just about the nursing homes being prepared, but it's about nursing homes and the greater health system being prepared, working together. It's about the greater health system being clued in and working with our emergency teams in our communities, those emergency teams working at the state level, working at the federal level, and having a better connection for preparedness and response and recovery from the top all the way down through.
Rebecca, you mentioned misinformation, and we're in an age now where a phrase that didn't exist many years ago, alternative facts, is out there. How do you combat misinformation? I mean, we've all talked to people who, they believe things, whether it's about healthcare or anything else, without proof now, and that's a significant difference from where we were, I'd say, a decade or 15 years ago. What's the best strategy?
So pharmacists are so accessible, and during COVID, for example, I worked with a number of physicians where he had challenges with staff because they were just so fatigued with the information not understanding. They didn't know where to fact check. So we would give them resources on how to get this information or give them access to a pharmacist. In addition to that, when the physicians would approach us with not just their staff, but also the residents and family, we would ensure that we would give them websites where they could understand that they could just Google fact check instead of just Googling the information they were looking for, so that we could give them accessible resources, not just on the computer, but also accessible resources with pharmacists in their community or remotely. We talked about telehealth, I think, a few minutes ago with the congressman. I think that's definitely an important initiative to combat misinformation as well.
Sue, same kind of question to you.
Yeah, I would say we really need to get on the social media leaders, the heads of Google, YouTube, Facebook. We actually wrote a sign-on letter with dozens of organizations asking them to crack down on misinformation and disinformation much harder than they did during the pandemic. They make billions of dollars in advertising revenue. And there's been some studies to show it's about 12 different sources. So it's not even that many sources that pump the majority of misinformation that we see on vaccines onto social media. And this is something Congress really should take up.
Tell us, Sue, why immunizing seniors is so important, and tell us about, quote, our best shot campaign that you've been spearheading.
Absolutely, and when you talk about information, I think older adults can be great vehicles for spreading good information about vaccines, because a lot of older adults remember polio. And back then, people would stand in line to go get their vaccines. They couldn't wait to get their vaccines. It's really important that as we age, we make sure to keep up with our annual vaccinations or boosters that we might need, because our immune systems weaken as we age, just like our bodies weaken as we age. And also vaccines can weaken over time, which is why we need annual flu shots, and strains change as well from year to year, which is why we need an updated COVID-19 vaccine. So it's really important that also older adults oftentimes have other types of chronic illnesses that can put them at higher risk for serious infections, for hospitalization, and for death. And COVID-19 vaccines, in fact, reduce the risk of death about 97 times among older adults. This is according to the CDC. I was just looking it up. It's 97 times higher in those 65 and up than in those 18 to 29. So getting your COVID-19 vaccine, actually for people of all ages over the age of 6, is really important, because you don't want to spread it to people that you love. And that's the main point of these vaccines, is to reduce the risk of serious illness and death. You may still get COVID-19, you may still get the flu, But the point of the vaccines is to reduce the risk of serious disease and also after effects like long COVID. The COVID vaccines are according to CDC's data, very good at preventing long COVID.
Rebecca, can you talk about the long-term care challenges on reimbursements, specifically on vaccinating seniors?
Yes, absolutely. So with the challenge with COVID during the pandemic, we were able to go and vaccinate for both Medicare B and A. Unfortunately, after the PrEP Act and all that's gone away, we can't get reimbursed, the pharmacies cannot get reimbursed for those particular billing codes. So what we've had to do is be a little more creative in how we've established our clinics to capture that reimbursement.
And what do you think of the ECAPS legislation that the Congress?
Well, it's going to effectively fill a gap. We talked about staffing shortages. We talked about having on-site resources. Unfortunately, since COVID, the retail organizations and retail pharmacies are not able to go in on site to the communities, the assisted living communities and skilled nursing facilities because they're limited capacity. They're closing down stores. And so really at PharMerica, we've been creative in how finding solutions for these gaps to ensure we can use our staff to help with the staffing shortages and decrease the burden of getting the COVID shots and arms in the nursing homes. Because we know, I mean, once COVID gets into a facility, we saw the initiation of COVID out in Washington. It went from wildfire from Washington all the way to Chicago. So we're very sensitive to that. In fact, earlier we were talking about Paxlovid, I believe it was Deborah. Our dispensing rates for Paxlovid has quadrupled since May, so we are really seeing that uptick. And Sue, you made a lot of great points about getting the shots, and I think we're seeing that in the communities. And I just want to mention, I just came from the third largest fair going on in the country called the Big E in Massachusetts. They expect 1 million fairgoers, about 90,000 per day. Janet Mikulski's here with me, one of our many partners at PharMerica to address the initiative for providing vaccines and access and administrations, and we have a tent set up there. We have a pharmacist leading the clinic every single day, and nurses and pharmacists administering it as well, because we know that pharmacists are not only the medication experts, they're the vaccine experts. They understand the storage, they understand the adverse reactions, the administration. So pharmacists really are your best opportunity to get the shots in arms safely and effectively.
And I mentioned earlier, Rebecca, the AMA has some opposition certainly to the bill, but have you, in your experience, found that people are comfortable with their pharmacists?
Oh, absolutely. I mean, at the Big E, I even had a surgeon commending us and thanking us, and so many healthcare workers, so many teachers, so many teenagers coming in with their grandparents and thanking us for vaccinating them to keep their grandparents safe, because they heard so many of their friends hearing about their grandparents passing away or getting sick and hospitalized.
Jodi, I saw you nodding your head a lot, so I'll let you.
Yeah, I mean, we're not doing great with vaccination, right? The general public is not doing great. We're not doing great in nursing homes. One of the major reasons that a lot of people cite for their reluctance to accept a vaccine is trust. And so I know when we're talking about it with nursing homes, we have folks who have come into the nursing home for a short stay. So they've been there 3 days, right? They don't know these nurses. They don't know the medical director. Or maybe they've been living there for a few years, but they still have these longer term relationships with the rest of the healthcare system. They have a cardiologist they've been seeing for years. They have a pharmacist that they've been seeing for decades, right? And it's always the same. And so I think that's why it's so important then when we're talking about how to increase vaccination rates, we really need to look at a whole of the healthcare system approach. And we need to get absolutely everybody in the healthcare system talking with folks about why it's important to get a vaccine. And we need to increase access through things like the ECAPS bill, so that for the folks who are willing to accept a vaccine, there is no waiting. We've got the people there, we've got the vaccine there, we have eliminated the access and the barriers to make sure that folks who want the vaccine can get it.
Yeah, I just really want to appeal to the AMA and ask them to stand down on the ECAPS bill. It's needed. We have a workforce shortage across the healthcare workforce in the United States. We need pharmacists. I take care of my mom, she has dementia. The pharmacists are a godsend to me. I manage my mom's medications. I organize them every week on Sunday for the whole week. It's over 10 medications. And they have saved me multiple times from, possibly running out of a prescription, last minute, to how do things interact with each other, to not remembering, is this supposed to be morning or evening? They're there, and they know, and they remind me about when my mom needs to get her vaccines. And they ask about my mom, and I see them more often than we get to see the doctor. ECAPS is not a threat to physicians. The pharmacists always tell me when it's out of their scope and I have to go ask the doctor something. We need this legislation. Over 200 organizations, including mine, support it. AMA, come on, join in.
Are you optimistic that it can pass before the end of the year?
Sure. It should, yeah. we need AMA and we need the will of Congress. But we can make it happen.
You mentioned the workforce, and Jodi, maybe we'll go to you on this. As you mentioned in detail, the healthcare workers were heroes during the pandemic. But we do have a healthcare shortage, as Sue mentioned. My 3 kids are playing their part. They want to go into healthcare, have no interest in journalism. They're smarter than I am. But that's a major problem. We're talking about, taking care of parents, and that's something they don't teach you in school. It's rough. It's very difficult. But our society is aging. What are the challenges there?
Well, I think you hit the nail on the head there. I think that society has a major issue with aging. I think society has a major issue with mortality. And that is why it is so hard, one of the reasons that it's so hard to attract people into aging services, is because we are terrified of what it means when we're staring aging in the face, right? What does this mean about me? What does this mean for my future, or for my parents, for my loved ones? And so I think that we really have to combat that on a daily basis. We need to work as a nation to come up with a better plan to support aging services. Part of that is going to be funding, right? We really need to invest in what's important to us. And if we're saying that older adults are important and that we want the latter halves of our lives to be rich and to be fulfilling and to be satisfying and to be healthy and to be safe and to have a quality of life and a quality of care, then we really need to invest in that. We need to put our money where our mouths are.
Rebecca, same question to you.
Yeah, so we know it's a fact. There's 10,000 folks turning 65 in this country every single day. And fortunately, the company I work for, PharMerica, we took on a challenge to find solutions this vaccine season, and we're going into over 300 assisted living communities and IDD group homes, intellectually developmentally disabled, to do over 300 vaccine clinics on site. This is to the tune of about 40,000 vaccinations, because we need a solution, and ECAPS will fill that gap, and hopefully we have some listening ears today.
I want to get each of your takes on what the congressman said about the concern about vaccines regarding COVID has spread to other vaccines, childhood vaccines, the flu vaccine. I think at this point there are some people that unfortunately are just not going to be convinced on any vaccine right now. But how do you convince the people who got the vaccine, thought they wouldn't get COVID, got COVID? I mean, that happened to many people, happened to me, but it was very reassuring because COVID was not a fun experience for me, that I wasn't going to die. But that said, there's this doubt now that is in society with very reasonable people who are still, I don't know if I'm going to get the COVID booster. I don't know if I'm going to get the flu shot. How do we, Sue, we'll go with you first. How do you deal with that? How do you combat that?
Yeah, I mean, you have to take time and you have to listen to people, and you can't be judgy, right? We're so judgy now about everything. People have been exposed to a lot of stuff on the internet and they hear things from friends and all of that. So you have to hear people's questions and have time to have conversations. And that's one of the reasons why I think when you go into long-term care facilities, there should be universal accessibility to vaccines. I mean, even the staff in long-term care have higher rates of vaccination than the general public. But part of what we have going on is there's so much negativity towards long-term care, which feeds into negativity towards aging and how we treat each other. So, you know, in terms of teaching people about vaccination, we have to get more of a sense of community back again. Not just taking care of ourselves or just our immediate family, but community and what that means. And to just take care of each other by keeping each other safe and making it available at your state fair, at fun places, you know, to go. So the more accessible, the more likely you are to get it. You can talk people till they're blue, but if you don't have shots immediately available to give them, they're not necessarily gonna say, all right, I'll do this tomorrow, I'll do it next week. You have to have the shots right there.
Yeah, and it's, you know, Mitch McConnell, who recovered from polio as a child, was stunned that, because as we all, well, most of us remember that it was a rush to get the vaccine. It was historic pace for this vaccine. And yet what he said he was stunned by is that some people wouldn't get it. So important for everybody to weigh in here. Rebecca, you know.
Oh, well, absolutely. And you know, I think the misinformation of a vaccine is a cure, it's a prevention. And really, it's, I think what people misunderstand is they're going to get this shot in their arm and they're not going to get COVID, they're not going to get flu, and they don't understand they're not getting the counseling that's so needed when they get that shot in their arm to understand the adverse events that they might experience. So they get a flu shot, the next day they get a fever and they associate, I'm always going to get a fever when I get the flu shot. Or they had a friend who had a bad experience with the COVID shot, so then they're like, well, I'm not going to get the COVID shot. But then there's others on the other side of that who have experienced those very sad stories of losing loved ones, losing friends that did not get the COVID shot. They got the COVID shot, and then there was guilt for them getting the shot. I'll tell you, I sat across from 1,000 folks this past 4 days, and there would be a couple sitting side by side, and the wife is like, I'm not getting it. And the husband's like, please, please. And I just said, well, you know, I'm not going to pressure you. You know, your husband loves you. He wants to keep you safe. Do you have children at home? Oh, you do? Oh, they just started school? Oh, okay. Well, you're protecting your children by getting the shot. And I would just state the facts. Oh, your children have grandparents. So just the counseling and the human, you know, relationship. And I'll tell you what, every time it worked. I said no pressure. Every time it worked, then they would get the flu shot and the COVID shot.
A quick follow-up there, but like I'm interested in just what you took away from the 1,000 people. What's the mood? What are the questions that the trends that you saw?
Is this the newest COVID shot? So they don't understand that we don't use vaccine from the previous year. They think we're just holding in a fridge somewhere and it's not going to be good for the strain. You know, and like what strains are this good for, like the flu, and just a lot of people just coming up and asking questions. They already had their shots and they come up and ask questions. I give them a vaccine information sheet or the VSafe website or the VARS information. So just a lot of counseling. I was very surprised. There's a lot of questions out there in the communities.
Let me go to Jodi first and then go back to Sue.
Yeah, I think it's I think it's about what the congressman said several times. I think it's about normalizing it. Some of the messaging is the same, right? It's not about you. Yeah, you're getting vaccinated to protect yourself, but guess what? You're actually getting vaccinated to protect everybody else. We all need to pull together. You may not want this vaccine, but think about those around you, right? But I think the other part of it, and where I'm hearing from our healthcare workers, where the challenge is there, is that we have this message that we have been putting out since the beginning of the pandemic about COVID will kill you, COVID will cause you to go to the hospital, it's a very terrible, terrible illness. If you get vaccine, you will be protected from severe illness, hospitalization, and death. All of those things are true, right? It can kill you. Vaccine can help save lives. But the trouble that we're running up against is that the message that we could putting out, especially when we're talking about these really terrible worst case scenarios, it doesn't ring true to the people that we're talking with because that's not their lived experience, right? We have a lot of healthcare workers who are out there saying, I hear what you're saying, but I see all these residents in the nursing home and they're getting mild illness. Or I have friends out in the community who didn't get vaccinated at all and they're not getting COVID, or they're getting COVID and it's mild illness. And so that's where the trouble comes in. And so I think that we need to get back on this normal side, like the congressman was saying, where we're telling people, this is what you do. You get your flu vaccine every year, you get your COVID vaccine every year. It protects society and we all move forward and we're able to do things like HHS's campaign, right? Risk less, do more. Let's get back to our lives. And the way that we do that is by making this a normal part of that.
Yeah, and I just wanted to add 2 really good resources. One is a coalition that we co-convene with Healthy Women and the National Caucus and Council on Black Aging. It's called Champions for Vaccine Education, Equity, and Progress. And the website is super simple. It's cveep.org, cveep.org. And then the other one is vaccines.gov, and that's where you can find out where to get your vaccines. And we actually link to that on the cveep.org website. We have a lot of different fact sheets you can use when you're talking to your loved ones, and please come visit us and join.
Last question, Jodi, start with you, go down the line, about maybe 30, 45 seconds each. What do you want policymakers to stress in the upcoming years? What frustrates you most about DC politicians?
Oh. Am I allowed to answer that question? No, I think the most important thing is working together. I mean, we all have the same goals, right? We all want to live in a place that is safe and thriving, and we can all live happy, healthy lives and be shiny, happy people, right? But to do that, we have to work together. And yes, there are some things that we disagree on, but there's also a lot of things that we agree on, and we just need to find what those are. We need to come together. And you know, I don't really have a taste for politics. I've never been involved in politics. I'm a social worker. And so I don't understand necessarily the chess game and holding things hostage for other things. Like, let's just get the job done.
Rebecca?
Well, and for me, I work with a lot of physicians, and we work with the interdisciplinary team together. So we know it takes a village. It's not just the doctor with the power of the pen. He's asking my opinion, he's asking psych's opinion, social worker's opinion, physical therapy, he or she, excuse me. And we know that it takes a team. If we're just going to rely on one person at the top, I think we need to understand that everybody's going to stay in their lane. They're going to do their scope of practice. They trust that they know that they can lean on their IDT folks, whoever that may be in the room, or pick up the phone to get that resource to ensure that we're taking the best care of this patient with their patient-centered care, what we call long-term care. But really, specific to long-term care, we really see a lot of need for this interdisciplinary approach. And it's really gaining legs, especially with the physicians, because they're so limited. Now there's nurse practitioners, there's physician assistants, and they have limited scope sometimes with their ability with the medications, and they come to the medication experts, the pharmacists. So I hope that everyone hears that message, that is part of the voting for this, and that we can move forward. And Jodi, I think you said it best. I mean, just working together.
Yeah.
Sue, will give you the last word.
Yeah, thank you. I would just say, Congress, please pass that ECAPS bill and also encourage the Centers for Medicare and Medicaid Services to fix the issues with vaccine reimbursement and coverage in long-term care.
Well, this has been a great panel that's focused on real facts, not alternative facts. Please thank the panel.
Well stated. That was great.
Thanks so much.